The postpartum period can be a time of excitement, happiness, and large life changes. For some, it can also include some unexpected, serious changes in mental health, such as postpartum psychosis. While postpartum psychosis is a rare condition, affecting one individual in every 1,000 births, it is a serious one. It usually occurs within the first few days or weeks after delivery and can come on suddenly or over time. It can affect one's thoughts, feelings, and behavior. People experiencing postpartum psychosis may have confusion about what is real, racing thoughts, or paranoia, such as a lack of trust and/or beliefs or thoughts that aren't true, which could be about one's baby or partner. Some people experience hallucinations, such as hearing, seeing, or smelling things that aren't really there. A person's mood can be very sad, irritable, or even hyper during this time. Sometimes these symptoms come and go, so a person may seem alright for parts of the day but not others. It is important to know that there are effective treatments that work to stop the symptoms of postpartum psychosis, primarily medication. At the same time, postpartum psychosis is considered an emergency that requires immediate treatment to protect both the parent and the baby. When a person is experiencing symptoms of postpartum psychosis, they should not be left alone with their baby. If you think that you or your loved one has started to experience postpartum psychosis, go to your nearest emergency department as soon as possible. If someone has experienced postpartum psychosis after a prior pregnancy, they have a 50% chance of it happening again. It is also more likely to occur in those with bipolar disorder, especially if they have stopped their medication. If you or your loved one has a history of postpartum psychosis or bipolar disorder, it is important to talk to a medical professional about the best way to prevent postpartum psychosis. Preventative steps could include protecting sleep from disruption in the early postpartum period and using preventative medications to help reduce the chances that postpartum psychosis will develop. The symptoms of postpartum psychosis are treatable. They are not permanent. Medications such as antipsychotics and mood stabilizers such as lithium can reduce symptoms quickly. However, most people benefit from a short hospital stay to ensure close monitoring and quicker control of the symptoms. In the hospital, doctors can do medical tests to make sure that the symptoms are not being brought on by another treatable medical cause, to be able to increase doses of medication so that they can get better more quickly and to ensure a person's safety. There are even medication options that can be used if the mother wishes to continue breastfeeding once she is feeling better. After a person experiences postpartum psychosis, they can benefit from support during recovery, including family and peer support. It is a time when a plan to prevent relapse should be put into place in case any symptoms start to return. A healthcare provider can help to create a plan that is right for you and your family. See our CAMAT video on treatment and relapse prevention for bipolar disorder and the Seeds of Hope guide for more information and resources on the CAMAT website. If you or your loved one are experiencing suicidal thoughts, postpartum psychosis, or are in crisis, do not hesitate to call or text 988 at any time or go to your nearest emergency department.